My name is Joan, and I'll be presenting peer support engagement, barriers, and benefit perceptions. This was part of my PhD that I'm still on, and I'm supervised by Dr. Rebecca Maguire and Laura Coffey. We focused on peer support. This was based from a systematic review that pointed to this as a gap, and then I did have the input of not just MS Ireland staff, but also 2 PPI panels with people with MS as well as MS caregivers, and they as well highlighted that this was an important bit that they wanted to see work done on. And it's already been said today, and I wouldn't stress that people with MS may experience psychological distress. Peer support could improve psychosocial outcomes in MS. And so we co-designed a cross-sectional mixed methods survey. The aim was to establish the levels of need and engagement in both online and in-person peer support, people's experiences with peer support, as well as associations with psychosocial outcomes, not just in people with MS, but in MS caregivers as well. Just that I will be focusing on findings from the people with MS going forward. So this was an online survey that was deployed between February and March last year. We had 218 participants who were majorly females, and they generally lived with relapsing remitting MS. In general, on average, they were 49 years in age. We did get a good turnout of people, almost evenly residents in both urban and rural parts of Ireland. And in general, most people lived with family or were in a relationship as well. What we found was that a lot of people expressed a need for peer support. About 60% of people did express a need for peer support, and just to say, 27% or 1 in 3, more or less, had those needs unmet. But despite this, there was also very low peer support engagement, whether this was in person or online. However, people rarely or never engaged in person compared to online peer support opportunities at the time. We went on to ask questions, open text questions, about what benefits peer support might offer. And the significant number of people said, that they got the opportunity to share emotional support or share common experiences or meet other people. For example, someone said it enabling more informed decisions about lifestyle, medication, emotional support for anxiety about the future, use of medication. Someone says, helps you're not alone. Great way to get information and make new connections. And finally, feeling less isolated, knowing that others have the same struggles. But there were other issues, benefits that people offered. For example, they could get practical advice, education, and understanding of their symptoms. Now, we asked people, both those who were engaging, what prevented them from participating in peer support, and then those who said they never engaged, why they had not participated. And what we found was the reasons were more or less overlapping, and so we combined them. And the principal theme that emerged from the data was the issue around low access. And for many people, it was about not being able to access or reach whatever is available at the moment, or not having resources to attend these opportunities, or the fact that what they wanted or their preferences were unmet. And then some people gave some specific barriers around participating online or through digital means, which I will elaborate in the following slide. But there were other issues. People had personal factors. They believed that peer support isn't needed. They lacked social skills, or they had attitudes such as fear or anxiety, or expressed poor health, such as fatigue. And finally, some people did state that they had experienced negative negative experiences while they engaged with peers. And these included things like negative meetings or meeting negative people, or the fact that beyond MS, they didn't have any connections with the people that they had met. Now, I just want to highlight, as I come to the end of my talk, issues around access, because there are some opportunities that are available, and so people had, and this is the most common reason why people experience barriers to peer support. The first being that they can't access or reach whatever is available. For example, quotes included, "There are no groups near me," "limited number of opportunities," and "don't know where to go or how to find it." About not having resources or preferences which are unmet, issues included things like confidentiality, hard to access due to public transport and lack of disabled parking, I suppose I like one-to-one meetings, but it's not really happening. And particularly around digital barriers, people said, for example, I'm technically aware, but avoid screen time. I have stood back and I have seen more bad than good come from people using social media, so I don't. Just to take away, some of our study findings are that peer support is actually important, is potentially beneficial and needed, but people rarely engage in it. Chief benefits include emotional support, sharing experiences, and meeting others. But people may be limited by access, personal situations, and/or poor experiences of peer support. And I think that these findings are relevant for targeting peer support opportunities going forward, but further research is needed to understand these associations as well with other psychological outcomes and between MS types. Finally, I'd like to thank the People with MS and MS Caregiver PPI panel. They were wonderful. I'd like to thank MS Ireland and, of course, Research Ireland for their support. Thank you.